about the health information exchanges. We've been speaking about that here at the conference, and there's been some discussion about the US model. They're about 3 generations ahead of us. So explain what that system offers and where you think it's going in Australia.
Okay, so you asked me a little bit before about the technology of our HRX program. Now what that is, and I'll explain that, and I'll explain the next one if I may. The first one is the HRX is actually a summary health record sharing system. It's a way to be able to get a summary health record from a GP and shared to the hospital in case of emergency, and also can take documents from discharges or consultants' letters and things to share backwards. So it's a sharing model. Okay. So now we're talking about and that's a technology sort of basis. Then you get on to the US models for health information exchanges. So what are they? The key component that they've learned in the US, this is now getting into very much is how do you run the governance model around a community of practice, because
service providers.
A community of practice it's a natural forming community that it follows referral patterns. So basically these are self-selecting. Patients often don't seek treatment out of a set geographic area. So you know what they are. That's where most of the transactions are happening. It's very local. It's not something where. So if you take a community of practice, a community which is almost self-sustaining, almost self-fulfilling, then they need to exchange information with each other. Now you can do that. It can be a technology base, and that's sort of what HRX, our Health Record Exchange program, is really around the technology base.
Yeah.
But you very much get into, okay, so how are we going to govern the uses of that data? How are we going to figure out who should and shouldn't be connected? Should it be the chiropractors? Should they have access? Should it be, there are legal and governance issues that you need to cover off. So the health industry exchange model is a model around creating a governance structure and an organisational structure that will support a number of diverse and competing interests, often by healthcare providers.